Title: Malaria Strikes Back, a Homegrown Menace in Texas and Florida. TLDR. Hide your kids, hide your wives. Malaria's breaking the 20-year streak, popping up like an uninvited party guest in Florida and Texas. 5 cases, 4 in the Sunshine State and 1 in the Lone Star State, have been reported over the last 2 months. For the record, these are the first locally acquired cases in 2 decades. You're probably wondering, are these cases linked? The CDC says no, and also points out that the risk remains super low for the rest of the country. Just so we're clear, malaria is that really nasty disease you usually catch from mosquitoes. No, it doesn't spread from human to human, but yes, it can be passed from a mother to her child during pregnancy or childbirth. So now you're thinking, do I need to worry? Let's dive deeper, shall we? So here we are, Texas and Florida breaking the cool, calm, and malaria-free streak that we've been enjoying for the last 20 years. Cue the dramatic gasp. But before you start wrapping yourself in a mosquito net, let's remember that the CDC reassures us that the risk is still low. Like finding a unicorn in your backyard low. But it begs the question, what's up with these cases popping up in these states now? Is it the climate change? The global travel? The mosquito rave parties we're not aware of? And most importantly, are we doing enough to prevent these tiny, annoying, disease-spreading monsters from crashing our party? Malaria is like that unpleasant memory of your embarrassing middle school years, except this one can kill. Seriously, malaria is a serious, sometimes fatal disease. Yeah, we're all pretty familiar with mosquitoes being the culprits here, but remember, it's not a human-to-human thing. Think of it as a very crappy gift from Mother Nature, from one mother to her child, that can happen during pregnancy or childbirth. Still, these cases do seem a bit random, don't they? Florida and Texas aren't exactly next-door neighbors. The CDC says there's no evidence to suggest the cases are related. But then, what's the connection? Or is it just a nasty coincidence? So here's the million-dollar question for all you health buffs, climate change crusaders, and those simply curious: are we headed for a malaria comeback? And if so, what can we do to protect ourselves without living in a bubble? Also, and perhaps this is the most critical question of all, should we stock up on mosquito repellent, or are we simply overreacting? After all, is there a line between staying informed and panicking unnecessarily? Let us know in the comments below. Disclaimer: this article is not intended as medical advice. Always consult a healthcare professional for personal health concerns.